viewer, welcome to this program today. We are on set with the director of Beryl's Medical Hospital, and we're going to talk about the mission they had about last week. They visited Lopii in Turkana, and we're going to talk about the activities they did there. And we know they partnered with the Sea Power. Please tell us, Mr. Ogada, how this assignment went down.
Oh, thank you. My name is Newton, the director of Beryl's Medical Center. We are here discussing about what happened in Turkana, a place called Lopii in Lopii. Before I go to that, I can just explain myself and what we've been doing towards that line of health. As Beryl's Hospital, we've been doing a lot of medical camps in different places, different regions, and let's say all over the country. We have been visiting places so long as there's a need. Like last year, we had medical camps in Beta, Guasi, other places, even in Kasipul here, we've been doing a lot of medical camps. But we have been thinking of extending our hands to areas with a problem like Turkana. And last year, January 1st, I was in Turkana camp in Nakuru County. I think that was around, it was fast, January last year. I thought of not celebrating the year just sitting in my home, but we went to reach out to people. And we were interested to go to that end, to meet our brothers and sisters from the other side. So we went to Lopii in Lopii, and we met challenges, not even only medical challenges, but even there's no food, there's no water, the drought is too much, and but it was a good move, and it was a good service to extend our hands to those people. So so that's what happened. And into detail, we managed to see close to 1,000 people, but not all of them were having medical challenges, but I think 70% were being treated and given some medication with different types of diseases. And more so, being it's a dry area, they have a lot of skin diseases because they just sleep down there, there's no proper housing, and they don't have toilets, there is no water points around, and I think this brought a lot of medical challenges that they're going through. And we managed to treat them, and what we saw there again is just even the pregnant women, it's difficult for them because the time they're giving birth, there's no any facility around, they just give birth inside the camp, and there's no proper preparation for a new baby like we do the other side of the country. And again, the girls, we find there's a challenge of education because most of the girls are not getting a chance to go to school because of the culture, and some are going to school and they even complain that even if you go to school and finish the school, again in Kenya there's no job. Yeah. So it's kind of, they waste a lot of time in school, and they're not getting exactly what they think they will get after school. So what I've learned, the place need a lot of civic education, and it need a lot of trainings, and again to fight against the culture, because most of the people there are still stuck in the culture, which actually bring them to bring the place to be pathetic, because they still believe on their cultural issues of doing things. But generally, my research when I was there was clearly indicates that we are failing as Kenyans to reach out to the people who are in need of health, and the health sector must actually look this into details. Because being they are still deep in their culture does not mean that we cannot reach them and give them the proper attention of treatment and even education. But as Beryl's, what we did was actually the best, because we did not wait till they reform, but we went there to make sure that we help the situation, and we are planning to go back again to do some activities there. And I will request even us, other donors or other partners to come in so that we can partner on sanitation issues, to dig toilets. Because for example, in this country, I see Ministry of Health is working so hard to arrest even those who have no toilets in their homes. But if Lokichar is still in the same mapping that they are Kenyans, that thing should be the same, you know. And we have the ministry, we have the MOH around there. But when we talked about it with the MOH, you know, he explained to me what is happening. You know, it's a sandy place, and if there's no enough allocation for that, then even if you dig the toilet, they will still sink, and nothing much will be there. So generally, the best thing to be done is just to keep on going there, giving civic education, and making the needs happen, that we treat them and we give them food. My observation again, the water, the sun, the water is a big challenge, and many people are dying because of they are thirsty. If they see with a bottle of water, they run and they stop you because they want that water. You know, the kids run to you so fast, and they make sure that you give them the water. Even the elderly, they beg for water than for food. So we are going to do something in the next medical camp, and I'm trying to reach whoever is willing to support us. We are going to put it public, so that in the next other camps that we are going to do, we will invite many organizations, many well-wishers, so that we can go as a team and do something that can be seen and can change the lifestyle of our sisters and brothers.
And I think you really did a very good job, because as you're saying, these people have no access to water, and they see a stranger passing by, they beg you for water. That is very sad and very unfortunate, and you pray that the government comes up with interventions that will help alleviate all these problems from these people, you know. But I commend you for the work you did, and my next question is just to ask you, did you achieve what you planned to achieve with this camp in Turkana?
Yes, we achieved, because our goal was to reach out the people and see their challenges, and again, our goal was to do the feeding program, which actually we did with our partners from Seed Power International. They really chip in, and they came with a lot of food, and we chip in with medical and equipment that we needed to have during that camp. So according to us as Berels, we achieved, because, you know, I think I don't know if I told you about the Berels. The Berels is not just an hospital like any other hospital, but Berels is the name Berel is having a lot of weight, because Berel is not my wife or my mother or my sister or my sponsors. Berel is just a little child whom I met who was really sick through infection of HIV. She was born with it, and their parents passed on. And being, you know, the life of an orphan is something which is difficult. She has been living in the hands of everybody, and nobody was there to take good care of her, even when it comes to the medication. So this girl died, but before she died, I came in as a dad, and I was responsible for the treatment and the bill. Unfortunately, the time was then, so she has to pass. So when she died, that thing was in my mind during then. So I was asking myself, how many children or how many people are going through this and die without nobody know? What can I do? You know, so that is when I came with an idea of registering an hospital and employ medical doctors and nurses and clinical officers, so that I can reach out to the people, you know, that are in the same level of problems. And if I was in Turkana, I was trying to relate the story of Berel and what was in the ground. Automatically, it was the same thing. I saw kids having life like Berel's, the Berel who passed on. And I said to myself that, God, you did something so amazing. You let me meet Berel, even though she passed on, but gave me the strength and the power to walk around the country and deep into the villages to see other children who are passing through the challenge that Beryl, the late, went through. And this motivates my heart that if you see something or if you see somebody suffering, you should not stop there. You should go deep and see what you can help. You have to reach your hand. So, I met Beryl today. I'm meeting many people with challenges because I met Beryl. And this motivates me so much. So, to your question, I'm sure that we achieved the goal, and we still have to go and continue doing things in this country. And I want the Beryl's hospital to be known by giving services to the people in the community, not just to treat people in the hospital. Because in the Ministry of Health that I'm running, I am sure I'm not running it to get money, but I am running it to make sure that I extend my hands to the vulnerable in the families, in the community, so that they can get better health care.
Yes. Yeah. You're doing a very good job, Director, and we pray that many actors will come and help support your idea and the things that you're doing. Now, coming back to my other question, you say there are so many places that needs medical care, needs the attention that you've given to Turkana. Why did you settle on Turkana? Why Turkana?
Just I said, like, I've been seeing news, I've been hearing people talking about Turkana. Turkana is a place of news. Every evening when you sit in your house, the first thing which will come if it is rain, you will see the flood was in Turkana. The bandits killed people in Turkana. The anger killed people in Turkana. The diseases killed. So I've been asking, why am I doing here? I need to extend my hand to these people, even if I support them once. But God will see that we did something. We show love. You know, when God speaks about love, people think different ways. You know, Jesus said, "Do you love your neighbor as you love yourself?" And I still have a strong feeling that the Turkana people are our brothers and sisters. So the way I love myself and and something happened, but we did not stop. We said, even if we are going to be killed while extending our love to our brothers and sisters, then it is worth dying.
You know, your life.
Yes, it is worth dying. If I die serving, then I believe that I'm going to heaven, and I believe that I will see the kingdom. So I will still go, and I will still reach to the places where, and I'm telling people that I will go wherever God called me to go. I will go to Turkana, I will go to Samburu, I will go to Masai, I will even go to Somalia if there's need.
Wow. That is very good. And to my next question, for those who might be willing to help and assist and they don't know the right procedure to follow, how would you advise them so that they can channel their help and maybe donate, give medications? How would they get access to you?
Yeah, like, you know, I've never started this earlier. I've been just using well-wishers from the United States, individuals who have been supporting, and at times I even take a loan from the bank or sell whatever I have to do it. But now what we're going to do, like, I know we have many people who are willing to support, but they don't know how to support it or how to extend their hands. So we are creating a channel where we will give our contacts and our websites, you know, linked with our accounts. So whoever wants to support will support us through that channel, and we will give the proper number for whoever wants to support. And again, I still believe that God will support me, because God will send the right people to stand with me during the kind need. And I know, you know, because sometimes I don't like taking all support, because some people support because they want something. But I always want in any of my organization, any of my project, whoever wants to support, you support willingly from your heart, deep from your heart. So you don't hold me, you don't put me on hold because you support. And I will actually again advise whoever wants to support can just go to Turkana and support. But whoever wants support through us must know that we are doing the right thing, and we are free to work with people, but not just to do like humanitarian aid, but just to show the love that Jesus left us with.
Yes. Well, thank you for this, and maybe you can just give a parting shot to the viewer just to share them and understand them, just to have a kind of encouragement.
Yeah, what I can say to the viewers and our friends and whoever is going to watch, let's have love in our heart and let us practice it. Because when you practice love, you do. You don't just talk. And before you reach Turkana or to reach a certain place, can you start with your neighbor? Because I said when I was starting, I've done medical camp even next to my door. So before you think of, oh, the Turkana people are dying because of hunger, because of medical whatever, can you go back and look to for your neighbors? Then if you see that need your attention in your next neighbor, then do it there. You know, the blessings is not only when you go far. You can still get it from any place, and do it from your heart. Do it through the love of God, and then God will extend your support to the other places.